They might come in with anemia, severe anemia. They might come in coma. They might even, the worst still, they can even die because of internal hemorrhage. Hi guys, welcome to my channel. This is Dr. K or Dr. Karen Mutembwa. I want to talk about ectopic pregnancy today, and I want you, if it has affected you or anybody else you know that has it before, call them. Let's discuss about ectopic pregnancy. Ectopic pregnancy, what is this? This is a pregnancy that is not in the uterus but can be found anywhere else in the abdomen. You can find it on the intestines, on the tubes, on the ovary. Can you believe that that happens actually sometimes? So some people usually get this condition. It might not be clear where it came from, but for some people, especially on the tubal part, it might form because the tube might either have very small space inside for the egg to pass through. So it remains there and grows, and sometimes it even ruptures. So some people might have had recurrent infections like STIs, such things. And also, it is also known that there could be some pills that you might take as contraceptives that might actually cause you to have ectopic pregnancy, like the E pill, and that is also a bit debatable. So let's talk about how people get this thing. Most people might not know when they have an ectopic pregnancy until it ruptures. When it's very, very young, very small, it might go unnoticed. Or if it's in the abdomen, it might even grow until it becomes a full-term baby. And we've had cases where people have actually delivered an abdominal pregnancy and it was alive, and for some of them, unfortunately, might have not made it. But when it's in the tube and it ruptures, and this is around 6 to 8 weeks, usually when it ruptures, there's a lot of bleeding, a lot of abdominal distension. People come with abdominal pain. It might be on the side that the tube has ruptured. They might come in with anemia, severe anemia. They might come in coma. They might even, the worst still, they can even die because of internal hemorrhage. So these are the ways people can present with an ectopic pregnancy. What we do as doctors, we first have to diagnose the ectopic pregnancy and manage it accordingly. In some cases, we consider to treat with some medication if it's too small or identified very early. But if it has ruptured, we have to go for theater, and we have to go in, remove that tube. We don't keep that tube because if we keep it, you might have another ectopic on the same position. So we remove that tube, but we leave the other one. The other one still works the same way as if you had the other one as well. So for those ones who've had an ectopic pregnancy, it's good news because we have gotten some people who've gotten pregnant after the ectopic pregnancy. Some may ask whether they really need to have a cesarean section after an ectopic pregnancy, and the answer is no. If you had an ectopic pregnancy, there was no disruption on the uterus, because remember, the pregnancy was not in the uterus, so it was in the tube. So if it is a question on whether they should have a CS or not, you can deliver normally after an ectopic pregnancy. So I hope this is good news for some of you, but you have to remember, the same thing that caused you to have an ectopic pregnancy might cause you to have another ectopic pregnancy on the other one. If it's an infection, get it treated. If it is if it's any issue at all, let it get treated. Don't wait for it to happen again. And if you have a pregnancy, start antenatal clinic very early. We are able to do an ultrasound, and then we are able to identify the position of that pregnancy. I hope it has helped some of you. Please comment, subscribe, and also like my channel. This is Dr. K, and have a nice day.